Glaucoma is a disease of the optic nerve whereby high eye pressure is the main risk factor. So imagine the optic nerve is just like a wiring between the eye and the brain. So it's important for the optic nerve to be functional before we can see well. Hi everyone, I'm Dr. Tan Yar Li. I'm an ophthalmologist practicing at the Asia Pacific Eye Centre, and I also do visiting consultant sessions here at the Parkway MediCentre. Glaucoma is often called the silent T for sight because in primary open-angle glaucoma, it often affects the field of vision from the peripheries, and by the time it affects the central vision, usually it's in the advanced stage and we can't do anything to reverse it. Whereas in primary angle closure glaucoma, this kind of glaucoma can sometimes be acute, so patients can present with eye pain, redness, headache, nausea, vomiting, and very often the pressure goes up to really high pressures like in the 50s and 60s, and if left untreated, it can actually lead to blindness. Glaucoma can be treated via different modalities. First of all, eye drops, lasers, and surgery. So very often when in the initial stages of diagnosis, we will often offer the patients eye drop treatment or laser treatment to help lower the eye pressure. However, in the more advanced stages, or if the eye pressure cannot be controlled using eye drops or laser, very often we need to go on to surgeries. There are some patients that unfortunately they don't feel any problems with their vision, so they feel like the eye drop treatment that we're giving is not showing any improvement to their condition. So it's important to emphasize to patient that we are actually not improving the vision, but what we are trying to prevent is actually progression of the disease that can actually lead to irreversible blindness. It's important to go for eye screening. As mentioned, glaucoma in the early stages is asymptomatic. So there is no real guideline as to what age one should go for screening. But generally, we advise that at the age of 40 and above, you should at least go for an eye check just to make sure you don't have any symptoms of glaucoma. And for patients with family history or other risk factors, for example, high myopia, or if they are on like steroids intake, or for example, if they have previous trauma to the eye, these patients should often go for eye checks maybe even earlier. And generally, above the age of 60, usually we recommend that patients go for at least annual check just to make sure there's no eye problems that they are facing.